Collaboration within the healthcare industry that's focused on the patient is rare but growing. Here in central Indiana, the large hospital systems have agreed on a clinical messaging protocol where they can communicate with docs and themselves about test results without having the patient have to have the same test multiple times. Now, you'd think that would be routine, but that's just in the last 2 years. There still is an absence of two-way communications between doctors. So if you go from Dr. A to Dr. B, the data doesn't necessarily follow you. However, we are working as a community, the hospital CEOs, to figure out ways to quickly implement electronic medical records, EMRs, for everybody, so there can be two-way communications and a repository for the database. Hospital CEOs have pretty much come to agree that their responsibility is the health of the communities they serve, not treating the disease in the communities they serve. Collaboration across the industry, and I view it as a very broad responsibility, from acquisition of raw materials to the administration of those services or materials at the bedside to post-discharge care. Coordination isn't occurring. In other words, the insurance industry, the medical device and the pharmacy industry, the hospital industry, the skilled nursing facility industry, the post-acute care and rehab industries aren't talking to each other enough. They have too many different business models. Some are not-for-profit, some are for-profit, some are 501c3, some are government-based, some carve out a cohort of population, old people, young people, injured people, psychologically disturbed people. It's too fragmented. We need policy leadership in getting the whole thing to be coordinated. Again, back to my mom. If my mom breaks her hip at home and comes to one of our facilities, she'll be discharged eventually to a rehab facility. And then maybe from there to a nursing home until she can go home. I guarantee you the person that will be seeing to it that the data about my mom is being transmitted successfully from each one of those places will be me. It won't be the system. I will make sure the data gets from point A to point B. Mother recently had a TIA, was in the emergency department of a local hospital with my wife and myself just in the last couple of months. As we presented her at the hospital, the nurse in charge asked Mrs. Evans, "What drugs are you taking?" Mother couldn't speak at that moment because of the TIA, but she pointed at her purse and we pulled out a 3x5 card with all of her drugs on. And I asked the nurse how often that happened. She said, "That's the first time." In other words, especially older people or people alone arriving in a critical care facility, there's no coordination between the nursing home where they were, their home, their church, whatever. And it seems to me with the internet these days, it ought to be easy to have data accessible to all, protected from being hacked in any way, shape, or form. But the benefits to be achieved from that kind of coordination far outweigh any risks that might be associated with having a common database for my mom's data.